All right, I'm thrilled to introduce Dr. Jonathan Carp to our community today, dermatologist and lifestyle medicine physician who focuses on the connection between skin, nutrition, stress, sustainable wellness. Yes, please. I love that word, sustainable. Founder of Miracle Noodle and Miracle Living. Through his clinical work and educational platform, he helps people better understand how lifestyle patterns affect not only how they look, but how they age and feel and function over time, which is so important. Welcome, Dr. Carp.
Yeah, thank you very much.
Yes, I'm gonna kick this off because you said this in a bullet point for us, and I think that this is really interesting, and I'm agreeing. But you said I tend to approach health from a practical and sustainable standpoint rather than that rigid diet culture mentality. So I'm curious from like dermatologist standpoint, lifestyle medicine, where do you even see that diet culture really playing into your work? And where has your life of work led you to where your passions all have landed?
The way I got to where I'm at right now was based on a patient of mine by the name of Karen, who healed herself of lupus on her own through diet and lifestyle. I had her on all kinds of organ transplant medications in the attempt to try to stop her lupus and put it in remission, and nothing was working. I thought I was going to kill her with the medicines I had her on, but nothing was working. I stopped the medicines because they weren't working, and she disappeared for 4 months. She came back and she was 95% cured, 95% clear. And not only that, and I'm still friends with her, she came back with a stack of books and journal articles for me to read. And she really was the one who kicked it off. Now, I always had an interest in diet and lifestyle, but not to the extent of really understanding and believing that it could be something that could be so profound and reverse conditions. And I put those books and articles aside. I didn't read them probably for a month or two, believe it or not.
Mhm.
And one weekend I brought them home and I devoured them, and pretty much my practice shifted dramatically. I became obsessed with learning about the power of diet and lifestyle. And it really is one of the most powerful and potent things that people can do. My health
Yeah.
philosophy is one that people need to become their own authority in health. And
Mhm.
when they do, they become really empowered. And there are many ways of empowering people. One of the things that I've recently was speaking about was getting people comfortable with the concept of ordering just maybe one of your lab tests on your own without a doctor giving you a requisition. Because now you can walk into a lab and you can actually get your own labs. Now, that doesn't necessarily mean that you're going to be an expert in all the labs that you have, but I found that learning about one particular lab like hemoglobin A1C, which is a measure of your blood sugar over the last 90 days, but more importantly, is actually an indicator of how fast you're aging and is also reflects in the skin because when your average blood glucose is higher, the sugar binds the elastin and the collagen in your skin and actually causes wrinkling. And what happens there is that the sugar binds to the collagen and it changes the elasticity of that, which leads to wrinkles. So the rate at which you're aging is one of the reasons why I like hemoglobin A1C. And ultimately, just the act of walking in and doing that on your own, it can feel like you're doing something wrong when you do that,
Mhm.
unfortunately. But when you get over that and you do that, that is one of the most powerful and empowering things that you can do. And your health trajectory and your strength, I've seen it so many times at taking action,
Yeah.
just magnifies pretty significantly by doing that.
I love that you're bringing this up, and I have so many different occasions in my head that just popped up because I remember sitting with my primary care at one point and asking, "Would you mind if we grab vitamin D and hemoglobin A1C?" And he pushed the prescription pad over to me and he goes, "Why don't you just check off what you want?" It's like,
Mhm.
okay, thank you. I,
Yeah.
I I couldn't tell if he was slightly annoyed or just found it a little humorous that we were having the conversation, but it was a moment of, okay, we can have a little authority in here. It wasn't comfortable, honestly. And
Yeah,
to your point, I think the more often we do it, the more comfortable we get with it. But I
agreed.
will also say, I even your story with your client with the lupus, that I think she's really lucky to have you as the physician and not roll your eyes. She didn't get the eye roll of like, no, you didn't fix this on yourself, or no, you didn't. You just dove into the research with her, which is such a blessing. And I don't know if that's always the story, right? So, like, when you're telling people, be your own authority, be your own advocate, do you notice that you have a lot of patients, clients come back and have stories for you of not getting necessarily that support from the medical community, or do you think it's the opposite?
No, it you don't get the support from the medical conventional medicine. It's a minority of people, of doctors who are interested in helping you with this. Predominantly, one, because they don't know how to do it. They haven't been educated in that. It took me many years to learn to feel even confident in giving diet and lifestyle advice, interventions, and the list of things. So you should I never like to say you should expect that you're going to get a negative reaction, but I'll just give you one little vignette, which is every Wednesday night I have a live class, call it Wednesday Night Live. And one time I was giving a similar lecture where I was explaining to go in, and one of the tests that I also recommend is called fasting insulin, which predicts much earlier, up to 10 years earlier, whether or not your blood sugar will become an issue. And this is one of those tests that there is not ordered by doctors, but is one of the most powerful things you can get because again, it antedates by 10 years this potential blood sugar issue. Additionally, since we mentioned a little bit about going deeper into the skin, when people have their insulin levels go up, their blood sugar actually stays pretty constant until the pancreas just can't hold out and starts to rise. But when the insulin level's high, that causes an increase in things like acne, for example. So adult acne in women. When I order tests for that, when I order blood tests, one of the tests I get, which is fasting insulin, and that's often elevated. And once you get that under control, a lot of those acne issues go away. From a systemic perspective, you're also intervening many years earlier to prevent prediabetes and diabetes. And of course, the wrinkling and the aging that goes with that. Also, people who get little skin tags around their necks and under their arms as
Mhm.
they get older, that's also been linked directly to insulin because when insulin is high, it's a growth factor, which causes things to grow. So these like skin tags that people get, if someone comes in to see me with that, even if they're not overweight or
Mhm.
have other problems, again, the pancreas does a decent job at holding the blood sugar steady, but that doesn't mean the insulin's not high. Eventually, as I said, the blood sugar will over time start to elevate. They come in, I don't have any other problems. I get a fasting insulin and it's extremely high and we're able to intervene early if they're open to making diet and lifestyle changes. And I might add that a minority of patients are interested in diet and lifestyle as much as it's a minority of doctors. It's also a minority of patients. We have been conditioned to expect a pill and an intervention that doesn't require any action on our part. That's just how we've been conditioned by our culture. And
Mhm.
so I always like to share the statistics, but I count, what my rate is, and it's around 1 in 200 patients who is interested in making a significant change. Now, your audience, of course, is coming to you because they're ready for a change. And so you have an audience that that I'm excited to talk to only because they're the 1 in 200 people, and they should see themselves as being special just for having turned that corner, where they really want to become their own authority, as I always like to say, and to take charge of things. And from a doctor who's interested in diet and lifestyle, as much as I like seeing the other patients, because I have a conventional practice, who I get the most satisfaction from the people who heal themselves, who take things under advice, but you have to honor the people who don't as well. It's an interesting dynamic, is the way I could describe it.
It is, and you're highlighting a piece that I don't think about as much of the frustration piece that could come from the physician's office of going, "Oh, I have so much more I could do for you, but I can tell that that's not of interest for you right now to take the pill first, and then maybe we can end up getting into their brains." My other story that comes to my mind was even from a dietitian standpoint. I remember my mom being like, man, my cholesterol's creeping up. My doctor's really on me about my LDL and like taking a statin. I don't want to do that yet. So she did the deep dive like your client did into
Mhm.
everything and was like, I'm going to go with a vegan diet. I'm going to really attack this with nutrition, fitness. In my head, I'm like, you already do it all. So I had a foot and mouth moment when she came back and changed her numbers. And I was like, huh, that was kind of my gateway into how your aha moment was of there's more. And I'm already living the food and fitness land, but here we are. We have deeper dives that we can be taking. So I appreciate you being here today to like keep speaking on this and letting people know. I think skin is interesting because this keeps coming up in my world that skin can be talking to us. It can be this indicator way before we see something else come up. Can you keep giving examples? I like the skin tag example. Other examples of things that you see within your clients that you're like, we should really be paying attention to this.
Yeah, sure. One of the reasons I got into dermatology is exactly this, that it is often you get to see signs of internal conditions before they may be manifest in other ways. So, probably the most common one that I see is repeated fungal infections in various areas or yeast infections is a sign of diabetes. And oftentimes, if you're getting rashes in the groin or under the breasts, that is an indicator of potential diabetes. So that's something. And then acne, of course, can be associated with not only this insulin issue, but also hormonal imbalances as well as abnormal gut health. Eczema is often related to or interacting, I guess is a better way of saying it, with gut health overall. And so when you improve not just the diet, making it more of an anti-inflammatory diet, if you get gut testing and or correct things in the gut, the eczema often also improves. Psoriasis is another very common condition. It's 1 to 4% of the population. And now we have pretty significant data that when people have even just a small amount of psoriasis, it's associated with inflammation in the cardiovascular system, which can increase the rate of heart disease. And so by doing aggressive lifestyle interventions and getting some of that inflammation under control, your risk for heart conditions overall can decrease. So it's not a skin only thing. One way to look at it is not just a reflection of what might be going on, but the fact that the skin in and of itself is an organ that has profound impacts inside the body throughout all the organs, whether that's through inflammation, whether it's through even just significant dry skin in elderly patients. It creates these little micro fractures in the skin, which can actually be measured on a net inflammatory level, meaning excessive dry skin in elderly patients is associated with elevated systemic all over inflammation of the body. And that's not just necessarily an issue related to you're not moisturizing enough, or it can be related to improper intake of essential fatty acids. It could be
Mhm.
related to poor gut health. It certainly could be related to external things, using aggressive soaps, things like that that take off the natural oil barrier of the skin. But oftentimes there's other issues that potentially can be going on.
I 100% agree. And then I think that anybody listening today would be going, okay, I do have some of those signs, symptoms going on. What are my next steps? How do you handhold people through that?
It's usually through labs, very, very basic labs. That's why I'm such a big fan of people just understanding a few of their numbers. I have 8 tests that I recommend for all patients to get. Two of them you've already heard so far in this class, which is hemoglobin A1C. And you want that as close to 5 as possible. And we spoke about fasting insulin, which again is another one that we've already spoken about. You want that under 10. One of the things that doctors even mistake is that these normal tests, the normal values are based on the average numbers associated potentially with some sort of codable disease process. Doesn't mean that we're optimal. So I think, quote, normal insulin is up to 18, but you really want it under 10 if you're going to get rid of things like acne and improve some of these sorts of other conditions. ultimately, understanding a few of these numbers there's another thing that indicates just net inflammation in the body. It's called high sensitivity C-reactive protein, HSCRP. That's another one of those tests. And that's probably our most potent measure of inflammation in the body. So knowing a few of your numbers is really important.
Yes. And like you said, yes, you could have like a primary prescribing this, but patients can also walk through the doors. And then
Yeah.
it's just kind of understanding what's going to be covered and what's not going to be covered, would you
Yeah.
say?
Now, a lot of these tests are not that expensive. Fasting insulin, it's probably $20. Hemoglobin A1C is probably similar, 20, $35 or something like that. And you're right, there are issues with it being covered if you order it yourself. But these tests you could probably convince your doctor to order. But as I always say, it is very possible that they will take affront at you asking, as you felt in your scenario. And what I would say to people is it's okay. I know it can be a little bit daunting when a doctor, someone who society puts on a pedestal of sorts, rightly or wrongly, disagrees with something that you're doing. But as I always say, you have to become your own authority in health. And it doesn't mean you can't discuss those numbers with your doctor. It's probably always good to be pleasant but slightly annoying to your doctors because 100% you'll get better care when you have a little bit of fluency understanding some of your numbers. This is what I mean about becoming your own authority in health. It doesn't mean you're the one that's going to be making all the medical decisions. It means that you recognize that you know you better than anyone else. And if a doctor ever tells you he knows you better than you do, then it's probably not the right doctor.
So well said. Thank you. Agreed. And again, just so empowering. And it's so amazing that we could listen to you today and then walk into our physician's office and be equally scared or put down. And it's okay. You just keep giving us that permission that it'll probably happen and walk away and just recover and continue being your own authority. Thank you. That is empowering. It's hopeful. And it's hopeful to hear like there are more labs out there that tell us things that we need to know than are what are coming up on our yearly labs. So this is definitely an area that we need to be our own authority, or else we're not seeing it. Even vitamin D, I feel like, and maybe you can speak on that for a minute because that feels like an easy one to me, and I still have to request it.
Yeah, that's another one on my sort of top eight is vitamin D. You can get vitamin D on Amazon. They'll send you a card and you just stick your finger and put a little blood in a circle and send it off. And yeah, it's one of those things that you should know about, with the caveat of learning a little bit about vitamin D and the fact that things like magnesium and K2 work hand in hand with vitamin D. And when you look at the data on vitamin D, just vitamin D supplementation on its own, the data is mixed. And I think the reason is because it's important to understand how these other things like magnesium and vitamin K work hand in hand with vitamin D. And anyway, I 100% agree. Not all doctors are going to necessarily order that, but it is one of those things that you should know your number on for sure.
So if somebody listening right now is going, "Oh, I'm feeling overwhelmed. I hear you. I've heard that magnesium and the K2 thrown out before, and I hear it all, and then I hear it and I put it away because I don't know how to get clarity around it."
Yeah.
What are some of your hand-holding steps on this?
Well, I spend time with it's hard to do in this sort of setting, but I educate my patients on that, and I certainly have lectures online about that. I often, unless someone has kidney issues, recommend taking vitamin K2 along with magnesium with vitamin D in a supplement protocol, or learning what foods you may be able to get that can boost that, and working with a dietitian for that particular example.
Yeah, no, I appreciate that. And just even from obviously you have things online, this would be good. Everything will be in the show notes as far as for our listeners to be able to go click into some of your live chats. And you can tell people where to find you. I was also curious, are you virtual with clients as well, or are you just center focused?
I have an interesting schedule at the moment. So as you know, I run Miracle Noodle, which is a brand of healthy products that I sell. So I do that actually the majority of the week. And then I see patients one day at full-time conventional practice, one full day a week. And then, yes, I do see patients virtually, mostly lifestyle, but I do dermatology as well,
Right.
telemedicine on occasion during the week. So it's kind of a hodgepodge schedule right now. And
Yeah.
then in terms of reaching, miraclenoodle.com is where my home is essentially. And that's where my Wednesday night lectures come from, essentially. So
Okay.
that's probably the
Best place to
best
find
way
you.
I.
I have to feel like you're loving your schedule right now. Isn't it fun to just have such variety in your week?
It is. It has its challenges like anything else, but
Good stuff. I just want the listeners to hear that we don't need to have all the answers figured out. We just need to know where to go hit play. And that's such a comfy way to start listening to somebody and then grabbing those free discovery calls or grabbing the virtual appointments. That there's a process to this comfort level. And I know I'm not talking to you, I'm just telling the listeners
yeah.
there's a process to getting comfy and understanding. And it's a slow grow, I think. Even as a dietitian, I feel like, and having a lot of background knowledge, I'm layering in through podcast guests, through integrative wellness, the understanding even better in all these areas, which it's just great. Like you were saying, you've learned so much from clients and learned so much as your career has taken different paths. And the podcasting world has done that for me because I get to meet people like you
Sure.
and go, "Huh, here's a dermatologist, here's a skin talk that really has not come up much out of 300 plus episodes, and this is a little new.
Hmm.
So this,
Yeah.
you're wonderful. You're definitely in your own niche, and
Thank
it's
you.
fabulous.
And I
Yeah.
would just like to say one thing, and that is that it took me time to be comfortable with the things that I'm talking about. I mean, everyone, as you said, has to go through their own process. But the most important thing is to realize that you have the ability, it is your birthright to be able to make decisions for yourself. You have the intelligence to be able to comprehend everything that we're discussing because it's part of being who you are. I just want to encourage people to recognize that I don't care how well you did in school. I don't care if someone told you that you can't understand this and that. It's all bogus. You are fully capable of understanding everything. It might take you a little bit more research, but you are fully capable of becoming your own authority and really being able to make those educated decisions for yourself.
That's such a beautiful response, and I back that. And it to me is comfy anytime I've heard something, I've read something, and then somebody comes on and talks about it, and you're like, oh, you believe that too. And then you hear the next professional that you're like, well, I respect you, and you're still saying the same thing that Dr. Karp's saying. That to me, I needed repetition
Hmm.
in the areas that were unclear. Hormones, being in this perimenopausal, menopausal season of life has all of a sudden led me. I feel like my community is very this. And that used to be a topic I used to really steer clear from because I just didn't understand it. And
Hmm.
now you better dive in or get off this list because this is where we are. I would be curious from your standpoint, how has this perimenopause, menopause time frame for your clients really hit you hard on conversations or how you handhold through those topics?
It's a difficult one, no question about it. It's also a period of change that there isn't a whole lot of mainstream education about. It's very underserved and it's a reflection, as you know, of the culture that we're in. There are other cultures where there's much more open conversation. And for whatever reason, our culture doesn't value the transition as much as some other
Mm.
cultures. We need to acknowledge that. The conversations are many because there are so many different aspects from a skin perspective that can come about. And in my scenario, we just try to deal with each one as it happens. And hormones are complicated. There's no question about it. And so I had someone in one of my classes ask, when am I going to give a lecture on hormonal replacement? And I said, actually, never, because it's not my expertise. And so in this realm, especially when you're talking specifically about hormones, my suggestion is that you have to find people who you trust and spend a lot of your own time learning and understanding this. That's probably not the most full answer, but the most experiential that I have to share.
Well, I think you hit the nail on the head that everything's so individualized that you're going to hear a symptom and you could point somebody in whatever direction they need to go with that. Whether that's under your umbrella of expertise or not, you'd be the resource to get them to their next
Mhm.
person. And that's, I guess, where I just see some people using this season of life of like, well, I'm going to have this experience because this is what I've been told. All health experiences, everything's so individualized. So that's where you came at it. And thank you, because I fully agree with that. What am I not asking you that you're like, I really wish your community would hear this?
I'm thinking of how I look at things potentially that might be a little bit different than maybe some other people. I mean, I think that the idea of restoration of health is better than anything else. In other words, what I mean by that is that your body has untold capabilities of restoring itself to a different level that you might not be experiencing, which I like to tell people that who have been not necessarily engaged in moving towards living a lot healthier, that sometimes you don't even know what your true baseline is. And so I always try to educate people in the fact that, okay, yeah, you might not have aches and pains, you might not have whatever the case may be, but you also might not be living, you might not be feeling as good as you potentially could be. And that's almost always the case when people start to embark on some sort of health improvement journey. They realize that they actually were feeling fairly unhealthy, even sick. And they thought that was just sort of the baseline because they didn't have acute pain. And so I always try to educate people on that. And then the other thing is a lot of diet and health advice is related to don't do this, don't do that. I am of the different opinion that the selective addition of a few things, whatever that may be, is often a lot more empowering because it's an action-based intervention, I guess you could say. So whether that could be, I decide to make and eat my own salad once a day, not because you have to eat salad, but because you're choosing to do something from an active perspective as opposed to having thousands of different things saying, don't do this, don't do that. That sort of philosophy, I guess you could say, is important. I can't think of anything else.
So
Yeah.
good. You're just a complete delight. I'm so glad we had this time together today.
Thank you.
And I'm on board with you with get out of deprivational mentality and get excited about throwing some extra fruits and vegetables in the mix. Go get excited about the walk with friends, just bringing things to a baseline level of do it. Take actionable steps because it feels good and you like it and you find a place for it in your life and get out of this I have to mode, I should
Yeah.
mode. Like there's nothing good about that. That
Yeah.
are hating ourselves into change versus loving ourselves into change is
Sure.
just where we see that sustainability piece come in. Like I could do
Sure.
something I like until I'm 100. If you force me to do something, I can do it for 30 days and then I'm done.
Yeah. It's
Yeah.
true. And the other thing is that ultimately we have this scenario of people who, well, I could look at it from a different perspective, and that is that when you just fix one narrow aspect of diet and lifestyle, and you focus on just pick one or two things, the willful discipline in one aspect of your life improves the quality of your entire life through some I don't even, it's some kind of magical thing that happens. And so don't focus on trying to fix everything. Pick a few healthful habits that requires a little bit of discipline and really everything else tends to improve. It's really a magical thing to watch. I'm sure you've seen it in your own clients and it's really a powerful thing.
Is we talk about it in ripple effects, just that like that one powerful thing ripples.
Yeah.
Just an example, taking a walk in the morning, getting our face out in the sun, all of a sudden ripples into, well, I drank more water
Mhm.
this morning, ripples into maybe I didn't drink as much coffee, ripples into maybe I had a more energy productive afternoon at work. I
Mhm.
love that one thing can change it all mentality because it's less stressful. And we're like, I can focus
Yeah,
on one thing. Got
exactly.
this. Yeah.
And you don't even have to focus on it forever necessarily.
Mhm.
As you know, because you're dealing with people to keep them on track of things, is that the data shows you just need to focus on a certain period of time until it becomes a habit. And don't focus on the fact that you're going to do this, that you have to go to the gym for the next 40 years of your life, 50 years of your life, whatever the case. Focus on getting the next 2 months of gym time. Don't put it on the calendar. A lot of people form a habit shorter than a couple months. So it gets to a point, I always like to say that it doesn't take any effort for you to brush your teeth in the morning. And that same kind of habitual work, same kind of habitual ease can be incorporated into your life. It just takes time to establish that routine to get to that point. And so focus just on the next 2 months of whatever that is. And by the end of that 2 months, it often will become a habit. And of course, all these other ripple effects that you describe and layer things on and the changes in your life can happen a lot more dramatically than maybe you can imagine at this point.
Yes, amen to that. So good. Thank you. So good. I like to wrap up with just, I think you've already said it, but if you could wrap your arms around our listeners today, if they heard nothing else out of your mouth, what's the one thing you want to be like, take this?
You have the 100% ability to become your own authority in health.
I feel like you've given us our topic today, our title. I know what this episode's going to be called. This is so good. Thank you for your time, Dr. Carp. We just appreciate you and your wisdom.
Thank you, and you too.